She's just finished her 3rd year of medical school at Northeast Ohio Medical University. She's planning to apply in neurology. She got interested in single-payer healthcare while working in public health systems in England and France. During her graduate research, she helped co-found the SNAP chapter at NeoMed, which has been a crazy busy chapter. And as a leader, in her chapter and on the SNAP Education Committee, she's been involved with local resolutions, panel discussions, workshops, and developing curriculum on private insurance that gets taught in medical school. They were also involved in a really important debt relief project that will see an estimated $50 million of medical debt wiped out for residents of Ireland. So pretty amazing. The next person, give her a hand. Next person to her left is Sanjeev Sriram. So Sanjeev, he's a general pediatrician in Maryland at FQHC. Nationally known advocate for healthcare justice and racial equity. He's been on our board for the last couple of years with PNHP. He's also been a senior advisor for Social Security Works. He was a leader of the All Means All campaign to make racial equity a cornerstone of the future national health care. He's been a contributor to Huffington Post, The Hill, Common Dreams, Rewire, We Act Radio, Act TV. He completed his medical degree in residency at UCLA, where he served as a chief resident in the Department of Pediatrics. Was actually my chief resident, so he was a year ahead of me, and my chief also. So we learned a lot about policy in those days. He earned his master's degree in public health after completing a Commonwealth Fund Fellowship in Minority Health Policy at the Harvard School of Public Health. So these are going to be your moderators, and I'll turn the floor over to the two of you.
Good morning, everyone. Y'all can hear me okay? Okay, great. All right, so we're going to quickly introduce our panelists, and I'm going to start with Dr. Abdul al-Sayed, who's on his way. He's going to be here very shortly. He is a physician, epidemiologist, educator, and county health commissioner. Abdul hosts the award-winning America Dissected podcast, attracting tens of thousands of weekly listeners. His 3 books include Healing Politics, Calling for a Politics of Empathy, and Medicare for All, A Citizen's Guide with Dr. Micah Johnson. His over 100 peer-reviewed publications have earned nearly 3,500 citations. He holds numerous academic appointments, is formerly the health director for the city of Detroit, candidate for governor of Michigan in 2018, and commentator at CNN. He's a proud member of the National Writers Union, AFT Locals 477 and 6244, SEI Local 500, and the AAUP. Dr. al-Sayed has been a longtime partner of PNHP, and we're going to have him very soon.
We are also welcoming Lawson, the Executive Director of Social Security Works, the convening member of the Strengthened Social Security Coalition, a coalition made up of over 340 national and state organizations representing over 50 million Americans. Mr. Lawson has appeared on numerous TV and radio outlets and is a frequent guest covering Social Security and Medicare issues on the Tom Hartman program, one of the top progressive radio shows in the country. He has a BA from St. John's College and an MPP from the George Washington University. Alex and Social Security Works have been a crucial partner in our work to end the privatization of Medicare and improve Medicare, co-leading the coalition to rein in Medicare Advantage, mobilizing seniors, and providing a crucial presence in Washington, D.C. One thing we really want to recognize that Alex has brought to PNHP into a lot of powerful places this year, like congressional briefings, a meeting with the White House, and a meeting with FTC Chair Lena Khan.
Okay, next we have Wendell Potter, who is the editor-in-chief of Healthcare Uncovered, which investigates healthcare corporations and insurance conglomerates in particular. In addition, Wendell is president of the Center for Health and Democracy, which advocates for meaningful healthcare reform at the federal and state levels. Since testifying before Congress in 2009, Wendell has spoken at hundreds of public forums, written op-eds for numerous media outlets around the world, including the New York Times and Washington Post, and authored 4 books, including the New York Times bestseller, Deadly Spin. Wendell's career in communications spans more than 4 decades, half of which he has spent as a communications and public affairs executive for major health insurers, Humana and Cigna. After witnessing firsthand how these corporations use strategic PR and lobbying to tilt the scales toward corporate interests, Wendell abandoned his corporate career to advocate for meaningful health care reform. The Center for Health and Democracy is a key partner in the anti-Medicare Advantage work, and Healthcare Uncovered routinely features PNHP's research and leaders in addition to its own stellar reporting. Thank you, Wendell.
And lastly, we're welcoming Dr. Taylor Walker. She's a board-certified family medicine physician and abortion provider based in Washington, D.C. She completed her training at Cambridge Health Alliance, a safety net hospital system in Cambridge, Massachusetts, that's academically affiliated with Harvard Medical School. A native of Memphis, Tennessee, and a graduate of East Tennessee State University's Quillen College of Medicine, Dr. Walker has seen firsthand the negative impacts of our broken healthcare system that prioritizes profits over people. She's currently serving as the national president of CIR SEIU, the country's largest physician union. Representing around 35,000 residents and fellows across the United States. Dr. Walker, like a growing number of CIR doctors, is a former staff member and current PNHP member, and has been instrumental in building a SNAP to CIR to PNHP pathway where physicians can build power and live out their values in school, the workplace, and society.
Before we get started with our questions, I just wanted to ask our panelists, when you're responding, please do your best to keep it to a minute, because we want to really tap into everybody's brilliance, and we've got a lot of challenging questions, so we'd love to be able to get through all of them and hopefully take questions from our audience.
That was directed at me.
So we'll start things very general. The tone of this panel was obviously very much impacted by the results of the election from a couple weeks ago. And I think we had better start by talking with each of you about what the election means for your organization, for the work that you do, and then for the larger movement of Medicare for All.
Which way are we going?
We can go.
Right here?
Yeah.
Go left. Go
All
left.
right, so, I'm an abortion provider and a union president. My whole life changed on Tuesday. On Wednesday, I guess. Without getting too technical, resident organizing, especially in the private sector, meaning non-government sponsored hospitals, is really dictated by the National Labor Relations Board, which is a semi-judiciary board of 5 members plus a general counsel. Those members are appointed by the president, confirmed by the Senate, and their job is to interpret and implement the National Labor Relations Act, which is a federal law that guarantees labor organizing in the private sector. The political leanings of the NLRB tends to shift with whoever is in power, whoever is the president, and especially whoever is in the Senate, which means that the composition of the NLRB is pro-worker under Democratic leadership and pro-management under Republican leadership, by and large. They have the ability to say that all residents organized into CIR or other unions in the private sector are students and not employees, and are therefore not entitled to employee protections or labor protections. That directly threatens the ability or the union status of 17,000 of our members. There is a chance that Trump's National Labor Relations Board will be in place as soon as day one in office, because he has made this an explicit target. Biden has appointed 2 people to the board, and if the Senate confirms them during this lame duck session, which do we think that's going to happen? Cross your fingers it does. If that does happen by some miracle, we are okay until August 27th, 2026. It is much more likely that we are going to face a very hostile labor relations board starting on day 1 of the Trump presidency.
I'd say that the day after the election is the day that just say, well, that happened, and what do we learn from that, and how do we move forward and make sure that we keep persevering. I use that word because I think it's very important. Sometimes the stars align for important policy efforts to to be realized, and sometimes you get a setback. Alan Adams' last slide said that defense alone is will not win the battle. Something to that effect. That's very true. But you also have to realize that offense sometimes is not enough either. You have to realize in sports and war and politics, you gotta have defense as well as offense, and to work. I think we're fortunate that we have to have a platform, Healthcare Uncovered, which is our journalism component, and we will be working to try to hold power to account, not just the Trump administration, but I think maybe even more importantly, the role of private industry in trying to influence the Trump administration in the next Congress. And so I think that's what we'll be doing. It's just trying to keep accountability journalism alive, and be the first to admit that it's also advocacy journalism. We have an agenda. We have an agenda to push forward to move toward universal health care to make sure that we ultimately achieve that. So it's just a different battlefield. We've played the cards we dealt.
Yeah, I co-sign that. You know, obviously the election of Trump and trifecta, but it's actually new because it includes the Supreme Court. So that's different, and obviously much more dangerous. It's terrible. That's what happened. But I spent a lot of time in swing states. I went to 5 of the 7 and was speaking with retirees, a lot of union retirees all across the country. And so it was not actually that shocking when the results came down the way they did. It was sort of predictable. You know, trying to win a campaign means that you oftentimes in public are like, we're gonna do this. But if you check the Slack channels of many of the people who were saying, we're gonna do this, it's like, why are they not doing this? Or we are getting on TV 7-1 with straightforward lies. And every hall that I went to, I was faced with the first question being, well, the immigrants are stealing our Social Security. What are you going to do about that? And that is a lie. It is not true. And yet, everyone had it in their brain because they were just being hit with this propaganda cannon over and over and over again. And you saw the exact same thing with transgender issues, which turned out to be the most powerful propaganda tool that the Republicans built, based on their own admission, the data. People just believed things that were not true. And that's why Donald Trump won. People didn't vote to cut Social Security. People didn't vote to raise their own drug prices. People didn't vote to give insurance companies more power to delay and deny their own care. They voted on things that they believed to be true, most of which were not true. Now that doesn't change the fact that we know what the Republicans will do, which is what they always do, right? They will try to cut Social Security. They will try to raise drug prices, empower pharma, empower United Health. I had a very colorful comment in Rolling Stone on the concepts of a plan. And I was like, oh, come on. We know what his plan is. Part of their game is to make us pretend we don't know what they're going to do. The media are like, oh, what are they going to do? And you're like, look, they always do the same thing. How do you not remember? It wasn't that long ago. Their plan is to give private insurers as total control over our health as possible. And what we know that means is that they will delay and deny our care. They will hurt those who need care the most because they are unprofitable. And so, while all of that is true, what the election means for us is actually it doesn't change things that much, and it makes some things easier. So, What I mean is, we've always fought for guaranteed health care for every single person in this country. You get sick, you get the care that you need, no deductible, no premium, no copay. I also want health economists to have to say sorry if they were wrong for decades. But our goals are the same: expand Social Security and have billionaires pay the same rates as the rest of us to do so. Break the pharmaceutical monopolies so that we can make drugs available to everyone who needs them without any profiteering at all, public production. Our goals are the same, and so that didn't change. And this is a little controversial, not in this room so much, but if it goes out on the internet, some people will yell at me. But it's important to do radical truth-telling in this moment, because what we are going to face is a barrage of, the reason that we lost, the Democrats lost, is because, they were moving too far to the left. And we're like, what are you talking about? But again, it's what happens every single time. So the way our work gets easier is that President Biden has been the best president of my lifetime. I say that without hesitation. I also say that knowing that bar is not actually that high. That there are a lot of caveats to that. The genocide in Gaza being a large Another one that is very related to the discussion is that he won by being the "I'm not Medicare for all" guy. He literally was parachuted in to be like, oh, I know this is super popular with the people, but not the donors. And so I'm the guy that is not for that. And we can talk about this more, and I know I need to stop talking. But that meant that for years now, and we've done great work, but our rallying cry has been, I know it's not enough, but it's the best that we can do for right now. That is a terrible rallying cry. Terrible. And you wonder why a fascist who's like, whatever your problem is, I'm going to solve it. Why? Well, because we didn't say, I'm going to raise your wages. I'm going to give you health care. I'm going to make sure that your life is made materially better. That's how you live. In this time, because again, you know what Trump, he's not going to solve a single person's problems except the billionaires who think that they need even more money. Our job is to expose that, bring it to the people, break the power of the propaganda cannon, and throw sand in the gears as well, I will say. They think they can do things with no rules, but there are rules, and they'll try to break them, and we'll try to use them against. Slow everything down, and hasten the buyer's remorse that will come when the people who voted on things that are not true and will not happen realize what is going to happen is their lives will get materially worse in the second Trump administration. And remembering that all power is with the people and comes from the consent of the governed, not from the government. I'm very hopeful that not only will we get through this era, but we can get back to fighting not for the best that we can do for right now, but what we actually need, a single-payer system for everybody in this country.
Dr. Lawson, thank you so much for joining us. We're so glad to have you here. For your reference, the question is asking bluntly about what the election result means for your work, for your organization, and for our movement at large, Medicare for all.
Yeah. First of all, I'm really sorry. I forgot to correct for the fact that when you cross state lines from Michigan through Indiana to Illinois, the time changes backwards. If they get something done about that. Grateful to be here, and I'm sorry that I'm late. A couple of pieces. So I spent the 3 months leading into the election day halfway yelling at Democrats and then halfway yelling at the Arab Muslim community in Michigan that I am a part of. And in some respects, I find this here today, and one does not ever want to be vindicated when it means that the potential, I don't want to say fall, but deep diminution of democracy is the consequence. But we had a Democratic Party that ran on vibes rather than actual policy, and then committed a series of fundamental political errors. And in politics, it's not just what you think about a particular issue, but it's what issue you talk about. And the minute we started talking about the border too, we lost. The minute the approach to 2024 was we're going to capitulate on the border and we're going to cede the fundamental issue area to you, we lost. And what's also crazy to me is that the last 4 years, whether you're talking about inflation or you're talking about the general ennui that we're all feeling, comes out of a moment where we as a society and as a country failed to take on the single biggest pandemic in over a century. And we had nothing to say about health or healthcare, which is wild. So, I run a local health department that happens to serve the largest county and the most diverse county in Michigan. I know RFK may actually be HHS secretary, so I'll just leave that there. And so we're in a position now where it felt like we were running on a treadmill, as in, to Alex's point, we weren't really getting much done when it came to public health and healthcare, aside from American Rescue Plan Act. And now it feels like somebody turned the treadmill off and is dragging us by our feet, and we're like clawing back onto that treadmill we were just on. That's what I feel. Now, I want to talk to 3 major cognitive errors I hope that we don't make in this moment. Okay? When I listen to RFK talk, he'll start with the naming of a problem. And I'm like, yeah, pharma sucks. You're right. And then he's like, because they manufacture vaccines. And you're like, wait, what? Or, we've got to deal with a chronic disease epidemic. I'm like, yeah, we do. And he's like, it's all because of red dyes. And you're like, no! And I worry that in the sort of hashtag resistance moment, the instinct is to collapse every mimetic discussion into the verbal equivalent of tug of war. So if they say something, we have to say the opposite. And I worry that if we're not nuanced in this moment about articulating the problem as it's stated and disagreeing with the solution, I worry that we're going to fall ourselves into a position where we're sitting here arguing for Big Pharma, right, and in support of the chronic disease epidemic. And so we've just got to be very nuanced about how we engage with this question. Second issue is this. I think the MAGA agenda or the MAGA political movement is really a lot more akin to the kind of coalitional movement that Democrats used to do. There is not one MAGA ideology. I don't think Donald Trump is intellectually consistent enough to have one ideology. But there are multiple people who sort of sit under one tent. I encourage you all to go listen to an interview that Ezra Klein did with Vivek Ramaswamy, okay? In which he takes on a lot of what J.D. Vance believes. But if you take the J.D. Vance ideology, okay, they believe in this ideology probably best described as this idea of national patronage. And under national patronage, what you basically do is you define who belongs to American society in the most limited way possible, i.e., I would not belong, many of us would not belong, a lot of us in this room looking out here probably wouldn't belong. But for that small group that does belong, that they should be provided a large and generous social welfare state. So, if anybody's ever watched Succession, sometimes life imitates art, there's this line in Succession when the family's making a decision about who to endorse, where one of them says, oh, you can't endorse him, he's Medicare for all, but abortion for none. And it's about an extremely right-wing Trumpy candidate. So I worry that what we may start to see coming out of the right is going to be a very narrowly scoped version of Medicare for all, just not them. Okay? And we are going to have to be very thoughtful and nuanced about pushing back on saying, everyone in, nobody out. Because you can imagine a version where somebody says, well, if you've ever gotten Medicaid services, you're out. If you're an immigrant, you're out. Right? So now basically what we've done is use these coded approaches to say there's only a small group of folks to whom we're going to extend very generous healthcare subsidies. I agree, it's probably going to come in the form of like a Medicare Advantage for all people who are not black or brown, right? But I think we need to see that coming, and the danger with this is just, I'm not trying to, this is going to sound alarmist, but I want you to break down what Nazism was. It's nationalist socialism, okay? Nationalist socialism. We got the nationalist part. I'll leave the rest here alone. The last point I want to make here, which I think is just really important for us coming out of this moment, is that the Democratic Party has a lot of social change to do, and it will do everything it can not to do that social change. Okay? Because let's be clear, right? The party is a function of a group of donors who dictate the bounds of what we are allowed to talk about, and a group of consultants who execute on very limited campaigns with those donors' dollars. You know who made out well in 2024? The donors and the consultants. Because you know what? Kamala Harris never said Medicare for all again.
Right.
Okay?
Exactly.
And the consultants ran the campaign. But hey, you know what? We should have found a better message. Should have made sure that we did X, Y, and Z more. The problem, though, is that we didn't have a discussion about the things that people are feeling in their day-to-day lives. So in politics, again, to finish where I started, it's not just about what you think about the issues, it's about the issues that you center and you talk about. So we have an opportunity, yet again, to reframe healthcare, and yes, public health, as one of those fundamental, 100% engaged with issues that ought to be the center of the next campaign. If we are now willing to articulate a world in which people don't have to worry about being kicked off their insurance, about whether or not they're going to go bankrupt because of a ridiculous deductible, about whether or not they're going to be able to afford their health care at the point of care, even though they're insured, then I worry that we're going to miss out on the future. And we have an opportunity to start jamming that conversation back into the Democratic Party. Because God knows if we want to win elections again, you've got to actually campaign on issues that people care about. People care about health care. The problem is that it's verboten to talk about because too many donors care too much about preserving the status quo.
I also just think it's unbelievable to follow all three of your careers for a while as a public health nerd, and I'm blown away to be sitting on the stage with you guys. But we talked a little bit about the resistance movement, right? And I think a lot of us in this room, I assume, feel like we are sort of part of a resistance movement, right? Really fighting against establishments and institutions that are so oppressive, that are really bankrupting people. My dad was a lawyer, and I almost had to use my mom's life insurance money to buy his house in order to make sure that our house did not get repossessed when he could not pay his bills for his chemotherapy treatment. That is insane. I am a white person in the United States whose dad was a lawyer, and that is the decision that I was facing at 28, right? Like, that is insane. But you're talking about the resistance movement, and one thing that really struck me last week is that it sort of seems like the resistance movement has been flipped on its head. The resistance movement seems like it's coming from the Republican Party, of breaking down the establishment and saying, I don't want these career politicians, I don't want these establishments, I don't want this structure, right, anymore. And it's a sort of rebellion against that. And that doesn't make sense to me, because I'm like, wait, the Democratic Party and our progressives and all the things we're fighting for, we're the members of the resistance, right? Like, what role am I playing in the Star Wars movie? And it's confusing. And the other thing that's confusing is that we as physicians are sort of reliant upon and forced to operate in this system that is definitely a representation of the establishment, right? Medical schools are part of the establishment. Hospitals are part of the establishment. We are forced to be part of that. And so we are holding a lot of sort of disparate things and a lot of disparate identities, and we're gonna have to figure out how to talk about that in a way that, progresses our cause and reestablishes the Democratic Party as one that really does serve the people and is trying to break down systems of oppression, not systems that give you vaccines and public education and other things that the Republican resistance movement is trying to break down. But we have to figure out how to craft that narrative. I mean, doctors are not very good at that. And I think one way you can do it is, and I'm a little biased, is through unions and through organizing. This entire weekend, and I'm so glad it is, because activism and policies and standing firm in your principles are so important, and it's really great to talk about at dinner parties, but it doesn't actually move the needle at all, right? And so organizing what we're talking about building power, I think, is so important to crafting and building that narrative.
Thank you for everyone's responses. The next question I wanted to ask, and I think that Taylor was kind of hinting towards this, is for a lot of us, this past election was the epitome of having our integrity tested. That casting a ballot, casting a vote was demanding on ourselves to figure out pragmatism versus idealism. And we are confronting that more and more and more, not just in our ballots, but in our everyday work, right? But to really kind of focus in on those attacks to our integrity. I really wanted to kind of ask each of you about how is it that we balance that integrity and maintain our values while being practical, making progress, and defending the people that we say we care about. Because I think that with the genocide that is going on in Gaza and the West Bank and Lebanon, that it's crystallizing for a lot of us that is such an assault on our integrity, and yet we have got so many day-to-day demands that are impacting real material lives, that we have to serve. So I want to kind of just start the other direction and start with Abdul first, but if we could just explore about that.
Yeah, I really appreciate you starting there. And so my first political memory was marching in a Palestine rally when I was 4 years old. My daughter's first political memory, who by the way was born into a political campaign, her first actual memory was marching in a Palestine rally when she was 4 years old. And the idea that my grandkids may have to march in a Palestine rally truly, honestly makes me sick. I talked about my community, the Arab Muslim community in Michigan, and the ways in which watching elders who look like your parents, children who look like your kids, be pulled in parts out of rubble for a year, and then watching the split screen of this manufactured campaign of joy on behalf of Democrats was nauseating. I was here, the last time I was here was during the DNC, and I was watching my phone and then watching the DNC, and how can you claim to campaign on joy when we are literally sending money we could be using to provide people in our communities health care, to drop bombs on other people, in pursuit of this idea that somehow it makes us safer as a country? And I think which is, if you focus, and I say this as a brown guy with a very long, very ethically sounding name. If all you talk about is what's happening abroad, politically folks will say, well, what do you care about me? But the connection is very clear. How much money have we shipped overseas in the form of bombs that could have gone to giving folks in our country health care? How much? And I think if we focus this frame there, and really talk about, there's an opportunity cost to our adventurism abroad, I think we can win. Now, here's the scary thing. Republicans learned that after, of course, 2 huge wars that they started in Iraq and Afghanistan, of course. But Republicans have been running on this message. The whole idea of America first, right? In the way that it's seen through the eyes of voters, is that we should be focusing on issues here. Now, let's be clear, America first means American corporations first, right? But there is a version that we should be talking about, which is rather than subsidizing foreign militaries who commit human rights atrocities, why don't we maybe subsidize access to healthcare for people who need it enough? Right? And I know that one local health department. I would love if rather than taking those billions of dollars that are now falling on children who look like my children, I would really love to be able to spend it in the county, which by the way has the largest concentration of Arab Americans in the whole country. I would love to spend it on the things that those kids need. All of this kind of comes back, and I think we need to lasso it. One thing I will say though, and I have been guilty of this, and so I start with myself first. Our critique of America often starts with the condemnation of America. And honestly, if you read history, it is not hard to condemn so much of what America is. But if you want to talk about it, right, benefiting America, it's very difficult to start with the condemnation of America. Right? And I just think we have to find language as progressives that embraces what America can yet be and ought to be. I love to make bombs bad, right? But the idea that starts, right, with a conversation of like, America's acted in these 5 ways, right? Rather than saying America can be so much better in these 5 ways. I think oftentimes it puts the starting line backwards. And I know it's really, really tough. I come from one of those communities, right? From which we have seen the hard edge of the worst of America, whether it's here in the United States or abroad. And yet, we've got to find language that speaks optimistically about what America can and should and must be, right? And I worry that always starts with, here's why America is not great, right? That people don't really listen to, here's why America can be great.
This is a great discussion. I might take it back a little to more that I saw in the swing states, because it's following up. Donald Trump ran as a peace candidate. You know that, right? Now, people voted for the Donald Trump. It boggles my mind, but people really believe that he is going to bring peace. There's a peace dividend coming. But then I remember, well, the Democrats are not the peace candidate themselves. So of course he's going to do that. And you see it in multiple areas. And so my analysis is it's really clear that right-wing populism, which is fascism, is being wielded extremely effectively against a corporate centrism, which is letting people down. And oftentimes is like, well, a little of this, a little of that, and a bit of austerity, and we should be fine. The bondholders won't be mad at us. And that leads right into right-wing populism winning every time. And the only thing that beats right-wing populism is left-wing populism. The biggest benefit of left-wing populism is that it can actually work. Because what right-wing populism is all of the pieces of left-wing populism, but remove the billionaires as the problem. Because right-wing populism, fascism, is to specifically protect the billionaires, who are the problem. Why do people not have guaranteed health care? Because some dude needed a $40 million job to drive people off of those islands, right? Because the greed of the billionaire class is insatiable. It's a philosophical question. Why are they so greedy? I have an answer. It's because they have a black hole where their soul should be. With money. And it will never be filled, so they will never on their own stop. And I use that joke a lot, but I also basically mean it. That is the problem. thinking that the billionaire class will in some way ever let off the gas. They can't. You can think of it in an addiction way or whatever. I just think of it in a more philosophical, they're evil. Left-wing populism can work because you can guarantee healthcare if you identify the billionaire class as the problem. Left-wing populism can work because you can eliminate imperialism if you can identify the billionaire defense contractors and military-industrial complexes as the problem. Left-wing populism can actually deliver, but left-wing populism has been sort of crowded out by this corporate centrism, which is basically how little of this left-wing populism can we do before our donor class, the billionaires, tell us to ease off, right? And that is a huge problem. I'm not really answering exactly the question, but it is my map, or my guidepost is a pragmatic solidarity that is truthful about what battlefield we're on. And that means, sometimes winning is just a long piece of losing, and it's painful. But hey, everyone remember how this went? I'll end. I think I got a little of the question in. But the start of Build Back Better was $7 trillion. Remember? We had $400 billion in long-term care. We had vision here in dental. We actually lost out on the out-of-pocket cap, just as an FYI, and why we're so insistent that we raise that one up first. Is because it was new, people didn't know what it was, but we need that in there first. There are so many things in Build Back Better, and it hurt every loss we took. And I was right there fighting, like, no, don't do that. And the three pharma dems in energy and commerce who stood together and snuck attacked us on reining in pharma with Medicare negotiation. And they drilled holes through it, and we had to negotiate and be like, ow, man, this is so stupid. Of course, we should negotiate all drugs right away. But I remember the game plan that I'm on, pragmatic solidarity, and I know that delivering lower drug prices will materially make people's lives better. And that's what we can demonstrate. And that's the only antidote to the right-wing populism lies, which says, through my authoritarianism. And I don't want to, I said it a second ago, they have to substitute in someone for the billionaires, right? That's their game. That's what right-wing fascism always does. It's not the billionaires. They just make money off of all of this. It's the immigrants, right? Or it's transgender folks, or they insert an enemy for people to focus their anger at their material condition on. And so maintaining integrity through either reversals and loss or the dismal times, I think is just being honest about pragmatic solidarity. We have to fight for as much as we can, but we have to make people's lives materially better along the way.
I just wanted to ask, thank you for that. I'd like to ask
Beautiful rant.
in the balance of integrity and maintaining the values that are necessary and important versus needing to do some things out of political expediency, I think there are a lot of people, especially young people, who feel a certain type of way about the entire system, right? There's many young voters, many young leftists who are not interested in voting, for example, because, to them, the integrity is, none of these candidates advocate for the things that actually matter. Voting for either of them does not achieve the goals that we need to achieve. And that's something that I think we also see to some extent with messaging and discussion about the ACA, for example. It's a very flawed system. There's a lot of very legitimate critiques to be made, and I'm curious what your thoughts are on sort of the desire to start fresh and maintain integrity with the system versus needing something to sort of mobilize around the political utility of having something imperfect that you utilize to get to something better.
I think the thing that related to that and what we've been talking about is the importance of maintaining your values, but being better at messaging our values and persuading others to understand and to get on board with what we advocate for. Alex earlier was talking about how so many people were persuaded to vote the way they did because of the border issue, because of transgender health care. Other than Pennsylvania, supposedly the swingiest, biggest and swingiest of the swing states. And it was just brutal to turn TV on and just be exposed to constant barrage of advertising that was, to me, very clear as what was going on, looking at Republican candidates. It was to get people to be fearful of something. And my 2 decades in corporate America as a communications vice president, I learned that fear motivates more than anything else. You get people to be afraid of something, you're more likely to persuade them to vote the way you want them to vote, and consequently vote against their own best interest, which is what we've seen so many times. My second book was Nation on the Take, I Big Money for Us, Democracy, and What We Can Do About It. It didn't sell nearly as well as Did It's Been because it's about an issue that's not all that sexy. It's about money and politics and who controls power in this country. And power in this country is controlled by big corporations, big special interests. But billionaires, absolutely, we saw that in this election. But largely, increasingly, it's controlled by Wall Street, and our healthcare system is controlled by Wall Street. A big problem underlying everything that we're talking about today is the financialization of healthcare. We've got to come to understand what that means and how we're going to confront that and how we can message our values in ways that resonate. So the challenge is really big. We've got to be able to understand what happened and why people voted the way they did. And surprisingly, to us, many of us, why would you do that? Why would you vote for someone or these candidates who don't identify with you? But it's because they had you afraid that if you didn't vote for them, you were going to be overtaken by people flying into the country, or that our values, this is a largely Christian conservative country. We've got to understand how they are able to persuade. And when I say they, I'm talking, frankly, about the corporatists, the people who really are running the show in this country and running our healthcare system increasingly. They have incentive, starting probably to a large extent in the Reagan era, and big corporations quickly got on board to get people to fear government, to oppose government regulations, to oppose taxes, and that is also a consequence of what helped to determine what happened on election day. And it's decades of people thinking or viewing government as part of the problem, or the biggest problem, without focusing on what the real problems are. And that is intentional by corporate America. They're masters in this direction, and pointing the finger of blame elsewhere, and pointing largely the finger of blame again toward politicians, toward government, toward Washington. And when you're doing that in this direction, you're able to take advantage of people in so many different ways, and to take over the Medicare program. And years and years and years, we've seen this on the slide earlier about the gradual taking over of the Medicare program by private corporations. It's really profitable. We've got to understand how those things happen, how they occur, and to really curb corporate power. We can talk, but I don't think anyone's ever mentioned Citizens United here today. That is ultimately what we have to talk about, is how we reduce the power and influence of people who have access to controlling the outcome of elections, and who spend so much money lobbying. Alex, I see it day in and day out in Washington, but also state capitals. We are so outspent and outstaffed on Capitol Hill. It's no wonder that politicians on both sides of the aisle are in the pockets of so many of these people who want to take over our healthcare system.
that writing is the root of all evil. However, if you guys do want to talk about that, I'm late. You sort of stumbled into one of my favorite topics. I mentioned earlier being this being a good fodder for dinner parties. My favorite dinner party rhetoric is how Democrats and progressives are so terrible at organizing. We sacrifice ourselves and our progress on the altar of our values and the altar of our integrity. And you know who doesn't give a damn about doing that? Who doesn't give a damn about his integrity is Donald Trump. Right? And look how he's able to move the masses. Like, I don't really care about my integrity when the denigration of democracy as we know it is on the ballot, right? And like, we are so good at losing because I want to prove that I'm a better progressive than you. I'm a better progressive because I drink out of metal straws and you drink out of paper straws. And also, you drink almond milk. Do you have any idea how bad that is for the environment? Shut up. We are so far from the base of Maslow's hierarchy that like no one even knows what we're talking about anymore, right? Like, and I think to the point of like being the establishment and institution and like really not sort of being able to fearmonger people who really turned out for Donald Trump this election, like they were able to use the fact that we were talking about trans rights and we were talking about Gaza as we should be, right? We're talking about abortion and we're not talking about how like Jeff, who works for, you know, who is a UAW member, right, a United Auto Workers member, a huge, incredible union who's very active in Michigan, can't pay his house note, right? Like, we really do need to realign with, like, your basic needs matter, and also, like, so do trans rights, so do abortion rights, so does breaking down these systems of oppression rooted in white supremacy. All of these things matter. And we need to talk about that. And you talk about crafting the message, narrative. That's hugely important. And the thing, I'll share a personal anecdote of something that I really personally struggled with. For those of you who were at the SNAP conference yesterday, you heard me talk about how the first thing that I did as CIO president was help to author, organize support for, and pass 2 resolutions at CIR's convention this year in support of standing in solidarity with Palestinians. There's a huge contingent of our membership that felt very conflicted about voting for Kamala Harris, right? And looked at the 2 parties and said, these are the same, right? And so I am not going to vote for this person, and I don't want to endorse her, and I don't want to campaign. And that's a valid feeling. It really is. It's so valid, and I don't want anything that I'm about to say to take away from the validity of that feeling and of that stance, right? Because like you said, we are still spending so much money, we are so directly responsible for this. And I was really grappling with this conversation of like, are they the same? Like, yes, we are both are doing this, right? And when I think about power, when I think about progress, right, I think about how can we build and use power, people power, to move politicians and elected officials in the direction that we want them to move. There are sessions later today about that very thing. And when I was thinking about this election, I was thinking, which one of these people would we be able to move, right? And to me, there was a clearer answer to that question. Not who do I feel better about voting for, but who do I think we could work to move in a direction of like not continuing this status quo that we have built, right? This like environment, oppressive system that we built. And that's not sexy. It's really not. It's not exciting. Progress inch by inch is not exciting or sexy. It's not motivating. But where I ended up landing is, you know, I voted for Kamala Harris. I campaigned for her. I canvassed for her, me and my meeting dog, and I did that because I felt like my integrity is not more important than the Palestinian kids. It's just not. And for that reason, I wanted to vote for the person who I thought that we as a population could move and could really have an impact on, right? And so, all that to say, like, I don't really give a damn about my integrity at this point either. I would encourage us to sort of think about that.
We love to signal to one another, right? Like, the whole debate about like straw discourse is about signaling to other people who already agree on your values. And the point I was trying to make about talking about what America could yet be is that you got to get in the business of persuasion. And when you want to persuade someone, you don't start where you are and then go to them. You start where they are and bring them to you. And this point about integrity, it's like the way, if you're serious, really, like you can have your integrity, right? But if you're serious about actually building movement and momentum, it's not about saying the things that people who already agree with you want to hear. It's about saying the things that people who don't agree with you need to hear so that they start to agree with you. And we got to get a lot better about that, and we've got to think a little bit about when we like condemn America, that thing that we often do, is that about signaling to people who already agree and they're like, man, they're so down with the cause? Or is it about actually trying to win some over? Because if someone's out there patriotic and believes in America, and you're like, you 5 reasons why you shouldn't believe in America, you lost the conversation already. Right? So we've got to get smart about asking, is this about signaling to my base so that they like me a little bit more? Or is it about saying what needs to be heard by people who are not on the base so that someday they might be?
One last question, then we're going to open it up to the audience. Many of us have patients that we feel accountable to, right? And in the coming years, we're going to see whatever healthcare they do have be threatened. And I'm a pediatrician, having to take care of kids. The overwhelming majority of them, nearly all of them, are on Medicaid, right? And in the coming years, if I'm having to defend this program, which I believe in only because the kids need it right now, and it's not because I believe in it, right? I believe in the kids. How do I wrestle with defending something like the ACA, or falling into this trap of like, I know it's not really great, but it's what we've got, and my kids really need it, and not really like winning over, and moving towards our true north, because I'm trying to think about my kids and not necessarily, lose, any of them in the midst of this longer fight. So, whoever wants to take on that question first. I know, Abdul, you run a public health department, so it's got a lot of overlap.
I think we get caught up in nuances of policy that the majority of people wouldn't see as different. Right? When you advocate for Medicaid, you are advocating for a government health insurance program for low-income people. Right? Which is a good thing. Now, we can all quibble about how porous Medicaid has been made to be. And so, as a policy platform, you're like, man, this is like the best worst version of this thing, right? Like, it's great it exists, it's awful that people have to use it, and also, couldn't it be better? And so we get caught up in this policy speak, and again, that comes down to talking amongst ourselves, rather than focusing in on the narrative of an America where nobody has to worry about whether or not they can get the health care they need when they need it, about whether or not their family's going to have to go bankrupt if they get it, and that we can all get to the business of being as healthy as we want to be. That, right now, means defending Medicare. And in the future, it means fighting for a world where we have Medicare for all. And I think if we focus on the narrative of those kids, let me tell you about this child, or this mother, or this father, right? I think it's a lot easier to square these things than when we sit down and have these policy debates that are meant for people who pay attention to policy debates, which are like 2% of people, right? And so, as a matter of public discussion, policy is not a great way to discuss what you want. Values and stories that marry our values to real people out there, that's the way we have this discussion. Now, you can use that to scaffold policy solutions, and if you're talking to policy people, then you gotta talk policy. But most of the time, when we're out there talking and defending, right? I think it really is about centering our advocacy in the stories of real people, in what we want for them and we all want for ourselves. And then when we get to the policy specialist topic.
I think it's a great question. I also have it's a sort of easy answer. This is an easier time when you're fighting against the billionaire class who are working to take people's health care away. Because the story is simple. I want everyone to have health care all the time. They get sick, they get the care they need, no premiums, no deductibles, no co-pays. That's what I'm fighting for. So obviously, I'm going to fight against anyone losing any of the modest health care that they have right now. So when they come after Medicaid, we're going to band together like we did under the first Trump administration. And you'll find the ACA folks and the Medicare for All folks and the policy difference folks, it evaporates in the fight against ripping health care away from people who already don't have enough health care. And that narrative, that message, I think, resonates really strongly because I know we sort of think of ourselves as in this room like lefties, but you know what sells everywhere? Medicare for all. You know who people everywhere hate? Pharmaceutical corporations. Like these are actual issues that you can talk with people who you don't think are going to be on the exact same wavelength as you. As long as you talk about it in a simple way. I want people to have health care. It's not that hard. Every other country does it. Why doesn't America get people health care? And then people are like, yeah. It is easier in this story than where we have been, where this is the best that we can do, even though it's not enough. So I do think in fighting the Trump agenda, we will find solidarity is going to sort of blossom in a more organic way, as we saw last time. And hopefully some of the metal straw, paper straw, that stuff just recedes against the over attacks of fascists on our health and our communities.
And then I think, picking up on what Abdul and Alex both said, in terms of messaging, it's really important to communicate with people on an emotional level rather than facts and figures. This is a wonderful forum to hear all these facts and figures. Adam's presentation this morning was, as they always are every year, just so compelling. That's for us. When we're talking to other folks, they're not steeped in this. You've got to connect with them on an emotional level. So your messaging has to move them. And facts and figures sadly just don't do it. As far as the patient, the ACA is concerned, we're going to have an opportunity, it seems, to message on that as the Republicans begin to figure out how to dismantle that. They probably will not go forward with, once again, a full-fledged repeal of it. But we'll need to be reminding people what the world was like before that flawed, insufficient bill was passed. Alex and I spent a lot of time, as many of you did, in Washington during the years, 2009, 2010, that bill was debated. We had to settle. It was not anywhere close to what we wanted to wind up with. It was very frustrating. But there are some very important patient protections. In fact, the name of that bill is the Patient Protection and Affordable Care Act. And I would argue that the first two words, the first part of that is more important than what remains as the name of that bill. Because it does prohibit insurance companies from calling people from refusing to sell their coverage at any price. It prohibits them from dropping you once you've got a cancer diagnosis, or charging people more for having pre-existing conditions. That's just some on the bottom line that are very important that we need to protect. These are foundational things. So Rose wrote earlier. We talked about, T.I. and others about, the word incremental is often in a crowd like this a dirty word. Think of it as foundational. We've made some progress, we've laid some ground here. We've got to build on that, and that was sadly as far as we could get. And when those stars aligned in 2010, there were 60 Democrats, at least 60 people who were voting for the Democrats. That's going to be some time before we get there, folks, to achieve that again. And we've got a Republican trifecta with this coming out. We've got to figure out how we're going to maneuver, how we're going to message with people who voted the way that they did. We're trying to keep moving forward with some foundational things, to keep things from being ripped away from us that were hard-fought protections.
We are talking about a lot of things that I really struggled to think through. Early in my career, as someone who is extremely stubborn and honestly doesn't like, I don't love to compromise. So I love organizing and I hate politics, right? Like organizing, I don't really have to compromise. I can be like, this is exactly what we want, and then we go fight for it and we mobilize power and we recruit people, right? Certainly when coming into contracts and all those things, we do compromise and that happens all the time, it's important. But in terms of really fighting for what you want, I love organizing. Politics is less sexy because you are talking about these incremental changes, right? And what I would say is we have to do both at the same time, right? Like we have to continue to advocate for Medicare for all. We have to continue to advocate for Medicaid expansion, for reproductive care to be covered under Medicaid, right? And we have to protect and fight like hell for the ACA to not go away. And it feels weird for me to say that because I have personal experience with being failed by the ACA. I had the audacity to go to medical school in Tennessee when I was 26 years old, which, for those of you who don't know, I don't imagine there's a ton of Tennessee representation in this room. Tennessee did not expand Medicaid. You understand this, you know exactly what I'm talking about. So, Tennessee did not expand Medicaid, and because I was 26 years old, and in medical school, meaning I did not have an income, I did not qualify for any type of support or subsidy to any state-sponsored health plan, right, Medicaid plan. Which meant that I had an $8,000 deductible, but a $500 per month premium, which if you do some math, ends up with me paying like 20 grand or more out of pocket before insurance starts covering anything, right? That's not health insurance. It was so ironic that I was a medical student, and again, a white middle-class medical student, who could not afford health insurance in the United States, like, because the ACA failed me because I ended up in one of the, we have a Swiss cheese model of structural failures, right? I ended up in one of those Swiss cheese holes. And I ended up in that hole. How many other people who do not look like me are falling into these holes, right? And now I'm sitting here being like, we have to fight like hell to protect this thing that failed me, and taught me what the cash price of an MRI is, it's $1,800. Because I played by the ball over my shoulder, right? And yet we have to, right? And yet we have to, and I think that's gets back to what I'm saying. Like, I am not willing to sacrifice myself on the altar of my principles and allow us to continue to lose basic freedoms and basic guaranteed rights for millions and millions and millions of people.
So, we're really sorry that we're out of time. I already know that there's like great questions brewing out there, and I apologize deeply for it. I am going to volunteer the panel. You can volunteer, not volunteer, to stick around during like lunch when you find them in the hallways to take your questions. These are for generous, brilliant people. Please find them, ask your questions, and we can keep the dialogue going. But thank you so much to all of us.